Hi, Dr. Pam here. So I wanted to thank you all for the positive feedback last week from the video series that I did. And I had a lot of you asking for more information, more details. So what I'm going to do this week is I'm going to do a little video series on gut health because when you're trying to treat any type of autoimmune disease or even just any chronic disease in general, the gut is really the foundation for your whole entire health. And the big thing that we focus on is diet. And I always tell people, you can do all the supplements in the world, but if you don't fix your diet, you're really not going to see that big a change from it. So one thing that I want to touch on today was the difference between a food allergy and a food sensitivity. And when you're dealing with different autoimmune issues, food sensitivities are a huge trigger for a lot of people. And the thing to keep in mind is that these are not a food allergy. So oftentimes I have people come in and they'll tell me, well, gluten's not an issue because I was tested for it and was normal. Dairy's not an issue because I was tested and it was normal. If you had a conventional test for a food allergy done, that is checking something called the IgE part of the immune system. That's checking for an immediate reaction to food. Most people don't have a lot of IgE food reactions. They have more what's called a food sensitivity, and these are mediated by a different part of the immune system called the IgG or even the IgA. So food sensitivities are something that can change over time. If you took out wheat and you started to eat a whole bunch of rice, you could develop a food sensitivity to rice in 6 months. And the reason for that is because you haven't done anything to fix your gut. So taking out the food is part of the process of trying to heal your gut, because you want to remove those triggers that are triggering that chronic inflammation. But if you don't do anything to go in and fix your gut, you're just going to continue to react to foods. And this is something that actually happened to me. So when I've been doing diet changes since 1996, and when I started to take out wheat at that particular time, I saw some things improve, but the thing that I was missing was that I wasn't doing anything to fix my gut. And at that time, we knew about leaky gut. We were talking about leaky gut and increased gut permeability in the 1990s, but we didn't have as many great protocols in place to go in and help to fix it. So what I started to notice on myself is that I got to this point where if I would eat something even like a salad, I would start sneezing, my skin would be flared, and it seemed like after every time I ate, within an hour or two, I started to have more and more symptoms. So one of the things that I did was I sit down and tried to look at what were some of the big triggers of foods that I was starting to eat more of. But the other thing is that you can do a food sensitivity test. So a lot of times when I have patients come in, I give them this option. I'll say, okay, you could do an elimination diet for the next 30 days. And with an elimination diet, you take out things like gluten, dairy, soy, sometimes eggs, sugar. Those are a lot of the big triggers for people. So you get those things out for 30 days, you keep a diary, and then you write down how you feel, and then you see if any of your symptoms improve. And then at the end of 30 days, you can start to introduce those foods back one by one, but you introduce it and you have a whole bunch of it and you see how you feel. And what you might notice is that you have the food maybe on Monday and it's okay, but you eat it on Tuesday and it's okay, but you eat it on Wednesday and now you're symptomatic. And this is something that I definitely noticed for myself, because since when I first took out wheat, I went through this hyperreactivity phase where I would react to even just a small amount of it. And I would get more of a rash, I'd get the cuts all over my face. And then now I can have a little bit of wheat and be okay. But if I started to try to eat it every day or maybe even 3 or 4 days in a row, my symptoms are going to come back. And a good way to think about this is that with food sensitivities, what they're doing is they're causing a lot of low-grade chronic inflammation in your body. So think about a cup that's half full, and you have this cup that's half full and you have this chronic inflammation because you're eating a whole bunch of gluten products. And now we start to add in stress. Now we start to add in environmental toxins. And those are the things that make the cup overflow. So you can't always control your environment, or it's really hard to control your stress sometimes because there's not just a switch to flip it off, but you can control your diet. And that's where, if you have this toxic load now that's causing a lot of inflammation, if you just take out those dietary things, it can help to reduce some of that inflammation in your body. The other way to try to identify food sensitivities is that you can do food sensitivity testing. And I want to kind of go back because a food allergy is mediated by what's called the IgE part of the immune system. A food sensitivity is mediated by what's called the IgG and the IgA. And food sensitivity testing, it's not 100%, it's not perfect, but it can be a tool. Especially some people look at doing that 30-day elimination and they think, I just want to know, I need a roadmap, I need to have some sort of idea on where to go. And so sometimes that's a good option for them to start with, to give them an idea of what some of those potential triggers are. So thank you, and look for more videos this week. We're going to be talking all about the gut, how to fix the gut, and different diets out there, and what you can do to find the right treatment for you.